campaign for the era of COVID. We're going to try it. It's something new. So thank you for being part of this experiment. It is definitely experiment. You know, we have this great system where every 2 years the House of Representatives has an election. And that is to keep people accountable for their actions. And I'm a big believer in accountability. And so every 2 years, I will have to prove my muster and stand in front of this district and ask for people's vote. And so what we are trying to do is do what we did last cycle. Go to people on a personal basis, try and connect with them, even with COVID, and ask that they consider us this election cycle in November. Obviously, the agenda items are really the crocodile closest to the boat, which is COVID, the public health issues, and the economic issues. And we have been working very, very hard to try and figure out how we're going to get through this as a state and as a country. To be honest, back in March, in April, when COVID was really hitting Michigan hard, I wasn't focused on the campaign. I was focused on the issue that people were calling us about, literally the phones ringing off the hook, which was the issue of personal protective equipment for our frontline workers, for our nurses, our doctors, our first responders, our firefighters. I just came from the Rochester Fire Hall, and hearing their stories about getting PPE in the middle of this crisis was harrowing. And we, frankly, did something I never thought I'd do in my life. We basically became dealers on personal protective equipment and finding people where we could buy personal protective equipment. And that, I'm sure you all heard the harrowing stories from our doctors and our nurses of people sharing masks, sharing gowns, not being able to get swabs, not being able to get reagent. We spent March and April on the phone, usually with Chinese middlemen in the middle of the night who were waiting in line at a factory in rural China to try and get some orders in for our hospitals and for our state. I will tell you that that is not a normal job for a congressperson. I have a national security background. You all know that. I'm a former CIA officer and Pentagon official. I did 3 tours in Iraq alongside the military. I met my husband in Iraq. We had a classic Baghdad romance. We met in Saddam's palace. And I have 2 stepdaughters, both in service. One is a brand new Army officer, and the other one is a physician at the VA, who is now, she's in Texas, working largely on COVID patients. So we're a service family. And to be honest with you, I was never into politics. Because when you're a CIA officer married to an Army colonel, you really take your oath of office seriously. You are not political. You work for whoever is your commander-in-chief. And I did that very proudly for almost 15 years. I ended up working for a time in the Bush White House, briefed him every morning, sent him a memo every night, and I was there the Friday that he left office, and there the Tuesday that Barack Obama was sworn in. Did the same job for a very different president. And to be honest with you, I would go and brief Congress as part of my role as a CIA officer and later as a Pentagon official, and it was never a club I wanted to be a part of. But the tone and tenor of what went on in 2016, the campaign in 2016, really just changed my thought on what we wanted out of our system, what we expected of people in leadership, especially in elected leadership. So I started thinking about running. But as Jim said, when you've never been a candidate, you've never kind of come up in the system, you don't really know how to do it. I had a lot of coffees with people to try and learn, and I was reticent to get in. But what pushed me over the edge was most definitely healthcare. And it's personal. Like so many things in life, we do things that we're personally connected to. And for me, that was my mom and her experience not being able to afford health care basically for much of her adult life because she had a pre-existing condition. She had breast cancer when I was a little girl, when I was about 4 years old. She was 31, and she survived, but for the rest of her life, she had a pre-existing condition. And it's hard to sometimes remember now, but until the ACA, it was completely normal to gouge people who happened to have a pre-existing condition when they went to go and try and secure health care or health insurance. My parents divorced in 1986, and my mom lost her job in 2002. And when she lost her job, she lost her insurance. And because of that pre-existing condition, when she, like Jim, went to go shopping for health insurance, she could not afford what was on offer to her. My brother and I were kind of finishing high school, into college. We did not know what her healthcare status was, but she went for 5.5 years with no insurance. So no checkup, no gynecological exam, no one saying, you had breast cancer so young, you should probably get a hysterectomy or some genetic testing. In 2008, my brother and I helped her get insurance here in suburban Detroit. It was $1,000 a month and a $10,000 deductible, so her highest bill, higher than her rent. And in the summer of 2009, without us knowing, she let it lapse. And in September of 2009, she walked into Henry Ford to the emergency room and was diagnosed with stage 4 ovarian cancer. Now, I'm sure many of you know what it's like to be in receipt of that phone call when you find out a loved one has a terminal diagnosis. I was in my early 30s. I was a CIA officer, and my life, as I knew it, exploded. And that same week and that same month that our lives were exploding were the same week and the same month that we were filling out the paperwork for her to declare bankruptcy. So, the issue of covering people with pre-existing conditions is deeply, deeply personal. And it's still the issue I hear, frankly, most about when I'm at the grocery store or I'm out getting soft serve. People talk to me about the price of healthcare, the price of prescription drugs, especially things like insulin, very common drugs. Clean water, making sure that as the Great Lakes state, we have clean water both to swim in and fish in, but also to drink. And then, frankly, what Jim was talking about, this idea that our elected leaders should be civil and decent. That even if we disagree, and Lord knows, my dad was a lifelong Republican, my mom was a lifelong Democrat, my in-laws are devoted Trump voters, that even if we disagree, it doesn't mean we have to be vitriolic, that we have to have a zero-sum situation. And I believe in bipartisanship in my very core. It's how I was trained. Because if you're over in Iraq, working alongside the military, going out with them into Baghdad, no one ever asks before you start that mission, are you Democrat? Are you Republican? No one cares. No one cares, because it's about the mission of doing things that protect people's lives. And that is what I see as my job as your representative. It is my mission and my responsibility to work across the aisle, especially now with divided government, to find those areas where we agree and get something done that improves people's pocketbooks, that improves the lives of their kids. So I'm extremely proud that we were able to pass 9 provisions into law in the past 18 months. 6 of those 9 are on PFAS and raising the standards on the issue of PFAS, since we know Michigan, unfortunately, is kind of leading the way on dealing with this issue. We've passed or pushed another 22 bills in the House of Representatives, all of them bipartisan. And people sometimes ask me, I get questions from people, frankly, a lot of Democrats who say, how can you work with Republicans? I'm just coming back from a day of working with Republican mayors in town after town after town, trying to deal with getting people what they need so their businesses stay afloat, so that they have the equipment they need to deal with people safely in their dental office. That is my job. And I hope the value proposition that I bring for your review is that my commitment to that, my mission focus, I hope, is worth consideration of your vote. Now, we just had a primary. On the Republican side, there was a primary, and we now know who we're running against. We have 85 days until the election. And something that's very important to me is to do what our founding fathers intended and have public forums, debates, where we can talk about the policy differences between myself and my opponent. So on primary night, I challenged my opponent to 3 debates in our 3 counties, Oakland County, Livingston County, and Ingham County. We want them broadcast as widely as possible for the COVID era, so that people have a real choice. And what I'd ask is that people look at the record, at the way that I've tried to go about the job. There is no way in a district like the 8th District of Michigan, which is a deeply independently minded district, that everyone's going to agree with everything I have done in my first 18 years. Lord, my husband doesn't agree with everything that I've done in my first 18 months, excuse me. And that's okay. I'd ask you to consider that while you may not agree with every single thing that I have done, I hope you believe me when I tell you I did it based on data, based on listening, based on my oath of office and my integrity. That is how I've tried to appeal to a district that has very disparate views and very different ideas about what they want out of their elected representative. So I thank you for coming. It's going to be a sprint these last 85 days. We all know election season gets a little wonky, and we're all usually happy when it's done. But I wanted to come out to Clarkston for folks in this area, which has been such a wonderful area to work with. I have worked extremely closely with the mayor here, Eric Haven, on this congested main road where people sometimes go a little too fast. We've worked on a bunch of projects together, and it's been my honor to represent this district, and I hope I'm given the opportunity to continue. So thank you for coming, and I'm more than happy to take your questions. All right, who will be, the COVID era, one of the things that's a hallmark of the COVID era is it's quiet. It's very quiet, So who will be a brave soul and ask a question? And you can ask whatever you'd like. Sir.
I was just wondering if this Trump White House filed some sort of brief or petition with the Supreme Court to rule the Affordable Care Act unconstitutional. And if so, that would make protection for pre-existing conditions go away. I wondered, did that really happen, or did I dream it, or was it a nightmare?
Yeah.
And if so, what is the status of that, and what do you think the prospects are for that sort of effort?
Sure. So I'm going to repeat the question for the folks watching on the live stream. So the question was about the ACA, and a question on the status of the lawsuit. It's actually called Texas versus California, I believe. And which was put forward by the White House to invalidate the Affordable Care Act. And let me just start by saying, in my 19 months now of being the representative here, we have been playing constant defense on an unending attack on those protections for people with pre-existing conditions. And the story I just told you about my mom, I actually got to tell in the House of Representatives, on the floor of the House, in front of 434 of my peers, because there was yet another legislative attempt to undermine those protections. We pushed it back, but it's kind of unending. The other one that came up, and it didn't get a ton of visibility, but we actually had doctors and nurses from around this area come to DC to talk about what they were seeing in the hospitals and doctors' offices, these junk plans. And these are plans that were originally intended to just be 3 months, kind of a bridge to another plan. And the White House signed an executive order saying that those plans could be 3 years. Those plans don't cover basic things like prenatal care, delivery, baby delivery, basic things that they just don't protect people with pre-existing conditions and consider being a woman a pre-existing condition. So we've been fighting to push back on that. And then this court case, which has largely been bubbling for the entire 18 months that I've been in Congress. In June, the president reinforced this court case by filing another brief explaining why the underlying principles should be overturned. So no protections for people with pre-existing conditions, no lifetime cap on total costs on how much you spend, let's say if you've got a rare disease, and no allowing your children to stay on your health care for until they're 26. They just filed that brief in the middle of everything that's gone on with COVID, you know? And the Supreme Court could rule on that case as early as October. So we are on pins and needles because quite literally, if the Supreme Court sides with the White House, 22 million people will automatically lose their insurance in the country. And hundreds of thousands here in Michigan. So that is a very big deal. It doesn't get a ton of press because we're all living in the 24-hour news cycle. But for me, and for many of us who depend on those principles of protecting people, it is the big kind of date we're looking at is October or potentially soon after. Thanks for asking. Yes, sir.
Jess, where do we stand on the HEROES Act that you guys passed with the negotiations with the White House?
So the HEROES Act, passed the House at the end of May. It was a negotiating position. There were things that were good about it, including making sure that our states have some money for things like our fire, police, first responders, or teachers. I want to make sure people are tracking that if we don't come to some negotiated deal between the White House, the Senate, and the House of Representatives, we are facing a pretty stark challenge in September and a potential layoff situation that none of us wants to see of the very people who have been on the front lines. It also passed some important provisions that I supported on bringing manufacturing back to the United States, particularly of medical supplies and pharmaceuticals, because we got caught with our pants down during COVID-19. I mean, if we are bargaining for a 78-cent mask with a Chinese middleman in the middle of the night, something has gone terribly wrong, and we've just outsourced our manufacturing to China way beyond what's acceptable. And there's national security implications of outsourcing to China like that. The negotiations with the Senate and the White House began in July. And as you've likely heard, after 2 weeks of negotiating, they hit an impasse. The president went ahead and put forward a series of executive orders this past weekend. I think the most effective one is probably extending a moratorium on students having to pay back their federal loans. The other executive orders don't have a ton of teeth because the U.S. Constitution gives the right to appropriate funds to the U.S. Congress. And so the president can move some money around, but he can't allocate and appropriate new money. So we still need everyone to come back to the table. I urge my colleagues on all sides of the aisle to just put down the partisanship and get back in the room to negotiate. What else? We have a question, I think, from the live stream. Yes, go ahead.
The person on the live stream says they're concerned about the post office
Yes.
and mail-in ballots. So would you address that?
Sure. The question from the live stream was, what is the status of the post office and delays and problems that we've been hearing about with the post office? So I think folks, just raise your hand if you've noticed any kind of delay at all in your delivery. Yeah, I think most of us have been seeing some delays. Maybe it's taking a few days longer. I know my brother mailed a card to my dad from St. Louis to Michigan, and it took 10 days to arrive. The place where we're really seeing the delays are the packages. Packages seem to be in a sort of a category on their own and are really being stretched out. So that's a problem in the near term for anyone who gets really important things sent in the mail, like their pharmaceuticals. A ton of us, especially Michiganders, have mail order prescription drugs, things like insulin, that come in the mail on a regular basis. And we've been seeing weeks long, sometimes 2-week delays on some of our packages. So the Postmaster General, the man who's in charge of the post office, made the decision that he was going to end overtime for postal employees. And it turned out the post office employees were doing a lot of overtime. So the delays that you're seeing right now are because they're not being paid beyond their standard hours. There is no option for working overtime. Obviously, this was a cost-cutting measure. And I think the thing that I'm concerned about is it just doesn't recognize how much particularly small communities depend on the post office. Particularly our older citizens really need our post office to deliver things on time. I was hoping that in a negotiated deal between the House, Senate, and the White House on this new COVID appropriation, there would be a deal on the post office. I still hope there will be, and that's another reason I want them back at the table. But this does obviously have implications for our election in November. We all know that we're now allowed in Michigan to have no reason absentee. We had huge numbers in the primary last Tuesday who voted absentee. And the Secretary of State is expecting 3 million Michiganders to vote absentee in November, which is way beyond our historic highs. And due to the delays, people are concerned about sticking that absentee ballot in the mail, right? And we don't want to have anyone have to choose between their vote, their democratic right to vote, and their health, especially our most vulnerable. So this is extremely important that we get this worked out. In the meantime, unless and until there's a deal, I just recommend that no one put their ballot in the mail after October 20th. I've just come to that point. There are boxes that our clerks have in their offices, and on election day, there are these boxes that are put out. You can almost drive right up to them and put your absentee ballot in there without going inside a polling location. It's not ideal, but it is my best recommendation given that we have a real sort of strategic problem with the post office right now.
Then we had another person on the live stream who asked about Social Security benefits and concern about the rising cost of living and also about the sort of stability of Social Security right now.
Yeah, the question was on the stability of Social Security. What is the status, and with rising costs of living, what's happening with threats to Social Security? So if you work your entire life and you pay into Social Security, you pay into Medicare, you should be able to use and enjoy those benefits when you come of age. That should not be a question 70 years after we've installed these programs, especially since you pay in. There is always a conversation about Social Security and whether it should be cut, the age should change, it should be made older when you start receiving Medicare or Social Security. This is kind of a perennial conversation. I am a big believer that those programs, people work their entire lives for them, and they should be there when they expected them to be there. This past weekend, the president, one of his executive orders called for a hold on the payroll tax. If you have a job, you probably pay a payroll tax. And what I think is important to note is that that payroll tax pays into Social Security and Medicare. It does. So we can hold it and either ask people to pay it later, which is a big old bill they're going to have to pay later, or we're not going to ask them to pay it back, and we're going to lose that source of revenue for Social Security right when we need it the most. So I can't, in good faith, support the president's decision on a payroll tax because I need that money going into Social Security. Where I would rather focus the effort is on getting people back to work who don't have a job, who aren't employed right now. Since we have in our state 21% unemployment. And like I said, the air in the room is just going to start to feel different come September, particularly if we're laying off civil servants, teachers, fire, and police. Anyone else from the audience here?